Symmetry is way overrated. What's up? Do you have an asymmetrical face and want to know if there's something you can do about it? Well, in this video, I'm going to talk to you about a procedure I do very often. So many patients that come to me for asymmetry of their cheeks, and they want to know if buccal fat removal will fix that. I'm going to cover that topic and so much more. And so if you have any questions, please leave a like or comment below, and don't forget to subscribe. So let's talk about symmetry in general. So the first thing I'd say, and this is going to be something that I'm going to get down to the point and chase, is that symmetry is way overrated. When we look at faces and you read literature, you find that symmetry in nature is important, from the Fibonacci sequence to what we read from psychologists about the attractiveness of a face and symmetry providing that. Now, our inherent evolutionary biology might be attracted toward symmetry, but in general, media, people, and personalities are not going to be looking at something symmetric versus asymmetric. Now, being symmetric isn't a bad thing, but I think that the problem is people seek symmetry instead of seeking harmony. Now, what do I mean by this? I mean that every single person has some degree of asymmetry. And when I have people coming to me for whether it's a surgery or cosmetic fillers, they're trying to make things more symmetric, thinking that others notice that. Now, remember that one of the worst things that you can do is stare at yourself in your magnifying mirror. But as a plastic surgeon, I understand that that's what gets people into my office sometimes. It's what gets people bothered by their faces. And when it comes down to it, it's not the microscopic view of symmetry that we're looking at, but the macroscopic view. And in the macroscopic view, what we're looking more towards is harmony. We find average faces attractive. A face where the size of the nose fits the size of the chin, fits the size of the lips, and the overall balance between the areas and individual subunits is far more important than symmetry. So when I have patients who noticed, hey, my left side of my face is a little bit different than my right, and every single time someone likes one more than the other, I always point out that this is completely normal. No one complains that they're right-handed and not left-handed, or that their heart's on one side and not the other. As a society, even though we are told that symmetry is beautiful, I think the takeaway point is that the average human isn't assessing symmetry in their conscious state. Perhaps subconsciously are, but that's not going to help you in terms of what you should set as your goals for your self-image, and especially when it comes to plastic surgery. Now, that being said, our asymmetry is caused by various things, and it's really important to note that when we get into the topic of today's discussion. The first thing that I would say is the vast majority of asymmetry is going to come from all three levels. So it's your bony structure, number one. The second area is going to be skin, and the third is going to be muscular asymmetry. Trying to fix just one level of structure, so saying doing lipo on one side of the face and not the other, is not going to correct any bony asymmetries. If this jawbone is angled and tilted 1 or 2 degrees lower than this side, that's going to lead to a pretty significant asymmetry. And why would you have that? Well, our face is developed in 2 halves embryologically. They fuse together. When they don't, you can get things like cleft lip, cleft palate. But when they fuse together, that little bit of genetic modification and differences or insults through that process of growth can lead to that asymmetry. Now, the second area is going to be skin. The skin is going to be asymmetric, not just because of how your face is formed, but also by environmental factors. In the United States, we drive on the left side of the road. I see so many patients who have their left side of the face lower than the right, and that's because this side is going to age even by the slightest degree at a different speed than the contralateral side, leading to that baseline asymmetry. And the third is going to be muscular asymmetry. As you know, a lot of us write with one hand, throw with the other, and that dominance on one side versus the other is going to lead to some baseline asymmetries. Now, with asymmetry occurring and existing on different levels, an often thought I get is, hey, my one cheek is bigger than the other. Can I do a buccal fat removal on one side, or can I take out more fat on one side? And for the vast majority of patients out there, I always tell people that should never be the goal of buccal fat removal. Now, first, let's talk about what buccal fat removal is. It's a fat that exists deep in our cheek, kind of underneath the cheekbone, and I tell people it's a cheekbone enhancement surgery, and we can slim the lower middle portion of the face by removing that fat through the inside of your mouth. It's a quick and easy procedure and can provide some amazing results like these photos up here. But in the end of the day, we should reserve it for making a face slimmer, not more symmetric. I did a study on my own patients where I measured the fat of about 100 patients sequentially, and I found that on these patients where we took out all the fat that was available, the delta or the difference between one side and the other was statistically not significant, meaning if you take the averages of them, there was not enough of a difference amongst those patients to say that some people will have more on one side versus the other. In general, you can always try to make it more symmetric, but the reason I recommend being even with both sides is that it's not really the buccal fat that asymmetric, it's the shape of the cheekbones and your skin and the volume there. And since we're not treating the actual problem, we can make the actual problem of asymmetry worse trying to correct it. That's pretty much how I approach the problem with many patients, and I understand that there are people who have significant asymmetries that bother them and they're trying to correct them. But remember to ask yourself a key question. What is it that's causing this asymmetry? And from my knowledge today, it's very rarely buccal fat. Hope this video answered a lot of your questions. If you have any more that you can think of specifically in regards to buccal fat removal and asymmetry, please be sure to leave a comment below. Until next time, talk to you guys later.